We are recording.
Okay, it sounds like we're logistically ready. Welcome to the Oregon Opioid Settlement Prevention, Treatment, and Recovery Board. Thank you all for being here today. Our objective today is to continue to move forward the work of putting together a request for grant applications process with OHA. You'll remember that at our last meeting, OHA staff ran through some scenarios of what that could look like. And today they're going to walk us through a high level roadmap to develop the RFGA. So as usual, we will start today with a roll call of board members and then get to board business. Adria will, of course, kick us off with DOJ updates. Tammy will review where we are on the fiscal front. Lisa will give a program update, and Zach will let you know what the research, evaluation, and data subcommittee is up to. Then Lisa will be back to give a high level overview of the roadmap to get to a working RFGA. And Jenny and Zach will review the results of the board questionnaire. Thank you for responding to that to give direction to OHA. And as always, we will have time for public comments. Before we start roll call, I did want to note and remind folks that April Roman is out on parental leave. We are very excited for them and looking forward to seeing baby pictures. So Amy Baker will be filling in for the next few months. I think Amy was going to be able to be here for the first part of the meeting today. And with that, I will turn it over to Lisa for roll call.
Okay, please let us know if you are here. Amy Baker,
Here.
Adria Decker,
Here.
John McElveen is flying today to a conference. Tammy Kane Suleiman,
Here.
Annalise Dolph,
Here.
Zebulai Payne,
I'm here.
Nick Ocon,
Here.
Lori Trieger,
Here.
Skylar Brocker Knapp.
Here.
Joanne will come at 11. Julia Hyduke, Carrie Brajati,
Here.
Rick Trelevin,
Here.
Fernando Pena,
I'm here.
Sheriff Matt Phillips,
Here.
Rep. Hi Pham, Senator Lou Frederick, and Judge Celia Howes. Roll call is complete.
Thanks, Lisa. I think as folks have noticed the past few months, we've been trying to put our vision up to start every meeting to center us on what our long-term work is. Today, we're focusing on one tiny little piece, but we have a decade's work in front of us. So this is our vision statement that we work towards a future in which fewer people in Oregon use opioids to manage physical or mental pain or to create a sense of belonging, resulting in fewer people with opioid substance use disorder. This is possible because there is a robust statewide system of physician education and mental health supports for people of all ages. If people do suffer from opioid overdose, fewer die as a result because emergency responders and bystanders are equipped and educated to reverse overdoses. People who have opioid substance use disorder have unrestricted access to high quality community based medical treatment options, regardless of how much money they make, whether they have health insurance, where they live, their race, their housing status, or their involvement in the criminal justice system. Care is coordinated and continuous when people move, whether it is from town to town or from the criminal justice system back to the community. Once people's substance use disorder has been treated, they have access to long-term recovery support services, including counseling, supported family reunification, employment support, etc. The board will know it has been successful when measurably fewer people in Oregon are using opioids, fewer of those who use opioids are dying as a result, and those who are in recovery are able to live full, rich, and meaningful lives. And as we move into conflicts, I will note, I'm sure folks have seen our overdose deaths are indeed decreasing. So that's something to celebrate. The call for conflicts, we put this up at the beginning of every meeting. For the record, I will note here that we won't be making a decision on any specific potential recipients today, but I'll give everybody a moment to read this through and call out any potential conflicts that you think you need to announce. Okay, I'm going to turn it over to Adria for DOJ updates.
Good morning, everyone. I don't have too many earth-shattering developments to share with you today. I believe I shared last time that we've reached an agreement in principle with the Albertsons company that is probably around the same amount as the Kroger settlement. So we continue to work with the company to develop injunctive relief that will probably be similar to other settlements that we've had in the past and move that forward. We are also actively, before and after this meeting, filing our complaints and judgments with the group of 8 secondary manufacturers. So that continues to develop, and hopefully that means that we will be seeing money from the secondary manufacturer settlement later this year. Purdue continues to crawl forward, and I don't have any updates at this time about when we'll be seeing that money, but it continues to move forward and not have any significant hangups. So we're confident that that is going to go forward. And then I think my last update is that the Department of Justice was able to determine that we had $346,000 left over from the additional restitution that DOJ received from the various settlements, meant to fund our billables essentially. So we had some money left over that we have transferred to OSPTR. So that is now Tammy might be able to tell you more about where that is in the ledger, but that should be available for use immediately. I'll take any questions.
I'll just say thank you, Adria, for continuing on from David. That I think you have just made everything so seamless, and the fact that you all are still so efficient and continue to be able to turn funding over to the community. It's amazing. We're very lucky.
Oh, thank you, Annalise. Appreciate that. I also have to credit, he doesn't come to these meetings, but the attorney that I'm working with, Ian Van Lowe, some of you may have had interactions with him, but he's continues to pull a laboring oar in getting all of the legal dots and I's and T's crossed and dotted. So thank you.
Good morning, everyone. I guess I'll just hop on here. I see the fiscal update slide. We do actually have some updates this month to share on the fiscal end of the settlement. If you could go to next slide, please. This table has been updated with additional payments received. Adria did reference that, and so I have a slide later that'll show exactly the payments that have been received that are reflected in these new tables this month. But the payments received for to date has been moved now to $112,495,057. So that is a new updated number. And that also changes our additional anticipated payments in the rest of this biennium, referenced downward to $22,371,657 of what is remaining expected in this biennium. And the allocations remain the same that they were last month, but again, due to additional payments, the amount available has changed. So again, we have another slide that I can walk through that. If we could go to the next slide, please. We do have additional expenditures to report this month. Again, exciting that the work continues after all of the great work that the board did to allocate the money. We're continuing to see spend down by the grantees. For these allocations, we now stand at 44% of total allocations spent down. We are going to have some additional moving up of an allocation amount, for example, the tribal number, because of the additional payments that were received from the Department of Justice that are reflected in the tables that we have going forward. So yes, we have updated spending, which continues. Next slide. And this is the update to our funds available for allocation in AY27. So the expected revenue was increased because of a payment, in addition to expected payments that we received, additional payment from the Department of Justice for additional restitution. And so that actually bumped up our payments by $300,000 or so, which we can see in specifics in the next slide. But this does bump up the total funds available for allocation in this biennium to that amount to $13,767,651. And next slide. This is the detail of those payments that I was referencing. So on March 19th, the Department of Justice provided additional restitution of $346,645.22, and that is now reflected in our payment table and available to spend per Adria's discussion. And then in addition to that, we were expecting the Walgreens 4 and the Kroger payment 3, and those are now officially in the fund as well. And so with that additional restitution, that brings our expected revenue in AY27 up to $36,355,252. And our remaining payments that are expected for the rest of this biennium that directly speak to the process that you're going to be doing for your RFGA is $22,371,657. And so that's how we're going to get to the number of being able to have that $13 million available for $13.5 million available for the RFGA process. So a lot of changes in our tables this month because of this additional restitution that came through. So I wanted to take a pause and see if anyone had any questions or clarifications needed. I don't see any hands up. So with that, that concludes the fiscal updates for this month. I'm going to pass it over to Lisa for some program updates. Thank you, everyone.
It's like Rick has his hand raised.
Oh, I'm
Tammy.
sorry. I
Yeah,
didn't see
I'm
that.
sorry, I had to think for a second. So we're going through a process to develop a RFGA for $13.5 million. Does this, with board consideration, would we have available $22 million to put in
Oh,
that?
thank you for this. Can we go back to the slide of the AY27 expected right there? Thank you. So great question, Rick. Thank you for that. We have that full expected revenue of 36 million, and we have to go back and remember that the board has allocated off the top 30% for tribal for every payment received. And then in addition, there's the statutory availability of 5% for administration. So we take that off. And then if we look at the difference that's available once we do that, it's 23 million to your point, but the board has already made some allocations for this biennium out of that available 23,630,000, including a harm reduction allocation that was done that was effective the first day of the biennium of 5,149,000. That actually is in process of being transferred right now from the main fund to the Save Lives Oregon Fund. And also the board made an allocation in January to the Behavioral Health Resource Network in the amount of 13 million. And again, that was a decision that was made. And we are, because of the available funds, as we wait for payments to come in, we're going to be doing this allocation in 2 payments. And right now, the first request for $5 million of a transfer to be able to help the burn program, it was really an urgent request that they came to the board with. That's already in process because we have available funds there to be able to do that first infusion. So when you look at those allocations that are taking out of that $23 million in the biennium, that's where you're going to be getting that $5.4 million. And then we also had an additional amount added to the available funding because of the data system allocation decision that the board made that moved 2,974,000 from the data system allocation fund over to available for allocation, reducing data system allocation down to 1 million. So when we take into account, we had a little bit of money left over in the previous biennium in AY25 of a little over 5.3 million. We have funds available in AY27 of 5.4 million. And then also that additional funds available from that data system allocation change. The total funds available become 13,767,000 that have not been allocated by the board yet for this biennium.
So I'm somewhat following you. The question I have is in January when we're making the decisions around the burn, the 13 million for the burn, the idea was that we had 26 million in the coffers and half of it would go to burn. So, and then the problem I'm having is you're telling me, oh, we have some additional money to go in there. So theoretically, we would have more than 13 million to allocate. And, but after all that you've done, we end up with $700,000 extra, which there's a disconnect there for me. And so, so sometimes when, an accountant like goes through a list of numbers, one of the tests I have is sort of like, does that sort of like look right from the big picture? And it's sort of not passing that test, so I'm missing something here.
Well, one thing right off the top that just occurred was the additional restitution from the Department of Justice that just came in for $346,000. So that is incorporated in that extra 700,000 that you're referencing. And Annalise, I see your hand up. Would you like to offer some insight as well?
So Tammy, everyone, feel free to correct me, and I don't want to disagree with you, Rick, but my recollection was that we had about 10 left, that we were going to give 13 to the burns and we had 10 left.
Okay.
And then we took 3 million from the data system allocation. And then we have this extra. In my head, it was 10 was
It
the
was
N.
it was 10 at that time. You're correct.
Oh, okay. Okay. Don't count on my memory.
And we're
Yes.
not accountants.
Well, again, this 13,767,000 available does include that 2.9 million that was brought over from the data system allocation. So that was not even in the discussion at the time that you made that burn allocation of $13 million.
So, I mean, but still the disconnect is we've been talking about this RFGA as a $13.5 million allocation that we want to get out. And so then you tell me that we've got some extra unexpected money and it just moves the dial by $267,000. So so if millions go into the top of it, but only a little bit comes out at the end, that's why I'm scratching my head.
Okay. Well, probably one thing to remember is that any payment that comes in, 30% right off the top is going to tribal. So that might be part of the gap there, is that 30% of all payments are going into the tribal and then 5% allocation for administration. And then from there, we just subtract out the allocations that the board has previously approved and voted on, and that is how we end up with the numbers where we are today. Does that help to clarify, Rick?
Let's just move on.
Okay. Thank you, everyone.
Okay, I'll chime in with the program update. Just going to talk about the Learning Collaborative that meets tomorrow. Next slide, please. So tomorrow's local opioid settlement learning collaborative will focus on what our law enforcement partners at the high intensity drug trafficking area are seeing in terms of emerging drug trends. And Isabel Cisco is our overdose response analyst in the public health division, and she does a lot of uh, data liaisoning with HIDA and partnering, and she really does a lot of work aligning and coordinating public health and law enforcement work. So I think that will be such an interesting presentation. And as always, we'll post the recording of her presentation on the ADPC website, link here. And every month, we also hear from Adria. She'll be giving the same update you heard today. And then just a little state update about what you, the board, are up to. And you are always welcome to come and listen in. You can either email that address at comagin.org, or you can just let me know or post it in the chat or whatever. We'll find you. So that's it for my program update. I welcome any comments or questions. Okay, I'm done.
Good morning, everyone. I just wanted to share a quick update about what the Research Evaluation and Data Subcommittee is up to. So we did meet last month and got an overview of some dashboards that currently exist that OHA maintains, and then some updates on sort of behind the scenes data collection efforts that are happening. The subcommittee is going to meet again in July and talk a little bit more about how the OSPTR board might fit in with broader data efforts that are already happening in the state of Oregon as a way to sort of maximize the efficiency of any data allocations that the board might make. So that is on tap for July. I did want to share in the chat a link to the dashboard demonstration that Liz McCarthy from OHA provided at that meeting. It's a really helpful overview of how to use a few of these SUD dashboards that OHA maintains and how to see different data depending on geographies or different items that you might be interested in. So highly recommend checking that out if you are interested in exploring those dashboards a little bit more. So that is in the chat. And that is it for the red update, unless there are any questions. All right, hearing none, I will turn it over to Lisa.
Okay, last month we
Just a
presented.
quick, Lisa.
Sure.
Annalise was going to do a little bit of
Thank you.
context
I
setting.
always
Yeah,
forget to check that. Thanks.
that's okay.
Although Lisa, you can set the table, I think, just as well as I can. Just a reminder to folks, we've been talking for several months now about this RFG process and have come to the conclusion that this one kind of tranche of funding that is left this biennium, that we're going to do some kind of request for grant applications. And at the end of the last meeting, we asked OHA to put together a survey so folks could express their opinions about kind of what that should look like. So thank you to everyone who participated in the survey. I do think we had majority participation. Is that right, PRR? Yes, awesome. Where there was a lot of places where there was substantial agreement, and that is going to be incorporated into what Lisa brings before you today. I do think if everybody can come to this with kind of the memory of what got us here. I know from reading the survey that there's a few people who kind of want to get to that next stage we've talked about, planning over the next 10 years, but we've reached a consensus that we're going to do this tranche right now. So if we can remind ourselves of that. And then there's some things that there is an agreement on that Lisa's going to talk about with us today in PRR to see where we do have consensus. And then they have some proposals for some additional work to get this off the ground. So with that, I'll hand it to Lisa to kick us off.
Thank you, Annalise. So I just want to let you know that the details of this roadmap are in your packet. And nothing I'm about to present is set in stone at all. This is just a draft of how OHA thinks we can implement this process in a reasonable time frame. And based on what I hear today, we will modify this roadmap and incorporate your feedback into the first draft of the RFGA materials. Next slide, please. So the goal of this presentation is just to review and then discuss how OHA will implement this RFGA process. Next slide, please. So what I'm going to cover is what we already know, what we don't know, how we will get there, how long it'll take, and then time for discussion. And during this presentation, it's nothing formal. Please do interrupt if you have a clarifying question. My colleagues are here. This was a group effort. I didn't put this together myself, of course. And so Courtney or our legal counsel, Shannon, if you see anything and need to jump in, by all means, please do. Next slide, please. Again, this is a draft. And I just want to let you know that the way we will be really hammering out all of these details that are needed to launch an RFGA will be developed through partner engagement. Obviously, our main partner is you, the board, but we also have other partners that we are consulting to make sure we're covering the right areas for funding. So next slide. So just a bit of background. As Tammy and Rick were just discussing, you've allotted $13.5 million to this process. And obviously, this opportunity has to align with your expectations. We also have some statutory requirements. And then the Exhibit E, the terms of the settlements, the famous Exhibit E. And none of this will be developed just by OHA. This will all be developed in partnership with partners. So next slide. Okay, next one. What we know. Okay, so here are the things we know so far that we have heard from you, the board. You would like this to be an opportunity with one-time funding, with two tiers of funding, so smaller grants and larger grants. You are still interested in funding the entire continuum of care, just like you did in round one of funding. We heard from you that you want this to be open to any organization that meets the requirements within the RFGA, whatever those end up being. The only organizations that are not eligible to apply would be state agencies. And you want to make sure that there is broad geographic distribution so that the funds aren't all concentrated in a few areas of the state. You want to encourage innovation. It's been emphasized to us right from the beginning that it's very important that this be a transparent and low burden application process. Not low burden for us, but low burden for grantees and applicants. And there's a lot of interest in reaching organizations who might not already have a relationship with OHA or have received state dollars. And I didn't put this in this slide, but I think it's in the packet. Also, you're interested in finding out if we can fill gaps with organizations that might be impacted by federal funding cuts. And then the time period for the projects to be implemented will be next biennium, July 1, 2027 through June 30, 2029. So these will be 2-year projects. I'll pause there. Did I get anything wrong, or is there anything I missed? Okay,
So
next
I'll
slide.
just,
Oh,
yeah,
go
just
ahead.
that I'll just say that there's because these questions were in the survey and we're going to be going through the survey and responses to that, there's also another opportunity at that point to raise any issues.
True. Okay, next slide. Okay, now we'll talk about what we don't know, meaning what we would like to hear the board discuss today, and then will be finalized through partners. Next slide. Okay, so what needs to be inside this RFG are these very strict parameters. So we need to come up with what's the overarching goal of this opportunity? What are the objectives? We already know there will be 2 tiers, but how much of the total budget will be allocated to each tier? And then within those tiers, are we going to assign a specific amount to each strategy or not? That has to be figured out. What other funding parameters need to be within this? Do you want to see specific communities reached, priority populations, et cetera? Um, Exhibit E has a lot of strategies. It's kind of the kitchen sink of prevention, treatment, and recovery. So, what are the strategies that need to be prioritized for this funding opportunity? And then I know there's a ton of interest expressed by board members about evaluation criteria, the scoring rubric, and how we will score these applications and what we are looking for. How do we assign points for specific areas of the RFGA? So it's a lot. I don't expect any of this to be figured out today. It's just to let you know there's a lot that we need to talk about. And it's important to me that we at least start that discussion today. And you know what? If you come to agreement on any of this, that's great, but don't feel that pressure. Next slide, please. Okay, so let's talk about how we're going to get there to get all of these components of the RFGA together. So step one, I broke the steps down into just high level numbered steps in your packet. So step one is our internal work at OHA. So this means assembling our core team, assigning roles and responsibilities to each person in this core team, putting together a project management structure with a project manager. And one of the big pieces is working with OHA leadership to assign surge staffing to the application review process. That's because we're anticipating a lot of applications. We don't know how many, it's hard to say, but based on other OHA grant opportunities, we know that it's rough out there and there are a lot of organizations looking for funding for this work. So we are anticipating a pretty heavy response rate and reviewing and scoring grants is very time consuming and requires a lot of people. So that's just one of the pieces. But I will update you now. We have assembled our core team. We've started to assign roles and responsibilities. Robin Yermstead is fabulous. She's our overall project manager, meaning she's got the task list and timeline and who's responsible for each task. And we've just started working on that together. And Courtney has started working with the OHA leadership about future staffing needs. So I'll pause there if there are any questions about this internal team that moves all of this work forward. Okay, next slide. This, I can't emphasize enough how important this piece is. This really is the piece, is who will we talk to make sure we're capturing current Oregon needs. And so obviously we're working with the Office of Contracts and Procurement. They are the ones who do all of this work to get grants and contracts written and monitored, and there are tons of legal requirements. Typically, Department of Justice will have to review this work. It's just a ton of infrastructure dedicated to this. And as required in statute, your main partner is the Alcohol and Drug Policy Commission, and we are so lucky because they are working on a document for us that will show alignment between Exhibit E and the ADPC comprehensive plan. So that makes our work a lot easier. And thank you, Annalise, for your partnership and your staff. Truly, it's incredibly helpful. And then because state agencies cannot apply to this opportunity, that's who we are allowed to engage. We're not allowed to engage any potential grantees during this drafting process. So some of our state agency partners are, for example, Department of Corrections, Medicaid, Criminal Justice Commission. We'll probably be talking to other programs that are working in this space just to see what they're hearing from communities about funding needs. And then we'll be going over this in a while, but we are asking for you to consider a work group or subcommittee as yet to be named, but for today we'll call it OSPTR Board Subcommittee. And then this partner engagement is definitely very iterative. We will keep you updated throughout. So I'll pause there. these state agency partners, that's just a couple that we're thinking of. But if anybody wants us to make sure we're working with other partners, please do let us know. Um, and one of the tasks of this work group or subcommittee will be to also recommend other partners that we can engage. So I'll pause there about partnerships and welcome any feedback. Okay, next slide. Okay, so number three is actually writing the RFGA materials, and there are many components to an RFGA. For example, it's not just the description of the funding opportunity and how much and what you can apply for. It's other things like a budget template, a work plan template, a scoring rubric, application review plan, etc. So all of these things will be developed by the OHA core team in partnership with these agency partners that I mentioned, the subcommittee, if you decide that that's a good idea today, and of course the large board. So next slide. Okay, so then once all of that is drafted and ready to go and everybody's feeling good about it, or as good as we can feel about it, we're going to launch it. And what that means is we post it online and we publicize it, we put the word out. So when that RFGA is posted, there's a lot of background work before that can happen. So, for example, assigning technical leads to develop and build, maintain, host a grants management platform. This grants management platform needs to be very easy to navigate, transparent, accessible by partners, simple, nothing too complicated. So all of that's underway. Courtney's been working on identifying staff for that. Thank you, Courtney. There's a public announcement process where we put the word out through all of our partner networks. We have lots of networks at OHA, making sure all this gets out, making sure there's a website with this information. And then once the RFGA posts, OHA will host informational webinars in English and Spanish. We will also have open office hours. And the way this works is the informational webinars basically walk people through how to apply. We'll just go through all of the components of the RFGA. Here's what you do. We'll answer questions. We are required to post a public list of questions and answers. So any questions that come up during these webinars or open office hours, we answer formally in a document. And there's a document that keeps being updated that's accessible by the public during this opportunity. And the open office hours are typically just drop in. We'll typically, at least in previous opportunities, we'll have organizations just drop in and ask us to help them clarify pieces of the steps or even questions about their applications themselves. We have strict parameters on what we can and can't say, but it's just a way for people to get more time if they're needing some help. So next slide. All right, so this looks simple. It's in 3 steps, but this is the piece where we need lots of people to help. So step one of the application review process is recruiting and training an application review team. And so it's not as simple as just getting a list of volunteers and sending out the applications. We have to walk them through the scoring process, how to use the grants management platform. Um, and there will be training sessions, not just in using the grants management platform, but also we'll be looking for the right subject matter experts to make sure that the people who review this know what we're looking for and have familiarity with the landscape of the SUD continuum. So then there's the reviewing and scoring applications. Typically, in the past, at least for grant opportunities that we've managed, scoring an application can take a couple hours each one, and we'll probably get hundreds of applications. And then based on those scores and some other criteria, the recipients will be selected and notified. So it's a very set in stone formal process about how this happens. And we really lean on Office of Contracts and Procurement to help make sure that we're compliant with all of these steps. Next slide. And then there's the actual grants administration. So once these recipients are notified, then we have to finalize their grant agreements, and that's a whole legal process, and then get the money out the door, and then manage and provide monitoring to these projects. So OC&P is there every step of the way as these agreements are developed. And then each agreement has an agreement administrator, so a contract administrator, and that person is responsible for all of the components, all of all of the legal components of the agreement. So what that means is developing a relationship with the grantee, providing help as needed, answering questions, making sure they're on track with their work plan and budget, meeting with them periodically to make sure they're able to fulfill their work plans and helping them troubleshoot or pivot as needed. Anybody who's ever worked on a grant-funded project knows that things happen, and a lot of times you have to change. And everybody who applies for a grant is making their best guess of how it will play out, but there are a lot of unknowns that happen. And so there's quite a bit of relationship building with grantees to make sure that their projects are going as funded. There's a lot of fiscal coordination. There's a whole a couple electronic systems. Thank goodness we have Tammy, who leads this process. But invoicing, expense reporting. There's a lot that goes into this to ensure compliance. And then we also provide technical assistance and program monitoring. And technical assistance can look different depending on the need. Sometimes it's just these one-on-one meetings between the agreement administrator and the grantee. We also work with, at this time, Comagine Health to provide program monitoring reports. And program monitoring is making sure that the funding went where it was supposed to go and the projects happened as the work plans were written. So we are, of course, doing that for our current round of funding. And I'm very excited to let you know that our first program monitoring report is in draft and will be published at the end of this month. And so Comagine will be coming to present you our first program monitoring report for the opioid settlement. And I think you'll be pretty excited to see some of this work that has happened. We'll be doing the same for this next round of funding. And then we will produce a final report. So all kinds of administration, and these are just kind of the five main things. There's a lot of other stuff that goes into it. Oh, and technical assistance can also be, sometimes we like to provide a webinar series on different topics based on what we're hearing from grantees. We've had a lot of luck forming cohorts. For example, Mackenzie Ballard, who's here, he's made a wonderful cohort with our focus grantees. They've said that it feels like a family. They love to get together and learn from each other. So we'll be looking to do more of that. There's a real hunger out there for organizations to connect with each other and help each other and learn from each other. So that's always an exciting component of this work. Next slide. How long will this take? Well, we gave you the news at the last meeting that we have opioid settlement payments coming in right through June of 2027. So what that means is we can't get the money out the door until the money's in the bank, right? And so all of these projects can't really start until July 1st, 2027. However, we can have everything lined up and ready to go to make sure that these projects can start on July 1st, meaning grantees are notified, agreements are executed, fiscal team is ready for payments, etc. So this year, right now, between now and August, if you decide that you can form a work group or subcommittee, we'll be meeting with you. We'll have our partner meetings. We've already started those. And we'll be putting together a draft. And then we really want this draft to be final to present to you, the board, at your August 5th meeting. So we've hit the ground running. And the reason we want this to be the final draft in August is because it takes a while to go through OCMP and DOJ review. Um, One of the advantages of OHA managing a grants process is we are held to really, really high legal standards and we have really strict parameters. And so we need to make sure that we have the time allotted for this process to happen. And then we expect to open the RFGA in October, and we'll keep it open through the end of December, and we'll close it at the end of the year. And then in 2027, January through April, we'll be doing the grant review process, grantee selection, notifying all of these grantees. And then in May, between May and June, we'll present the final grantee list to you. That's when we'll be drafting all of these grant agreements, and we'll be working with our with Comagine Health on the plan for program monitoring. Projects will be from July 1, 2027. They will go through June 30th, 2029. So based on that timeline, we would come back in October to present a mid-project report to you, October of next year. And then the final report will be in 2029. That being said, that's not all you'll hear from us. As you know, we love to bring in grantees and share what they're doing and give you little updates and let you know when things are happening out there that are exciting and give you a chance to hear from these grantees. So that's what the timeline looks like. And is that it? Is there another slide? No. Okay. So I'll stop there and see if we have clarifying questions.
Thanks,
Or
Lisa.
if my colleagues want to add anything that I might have missed.
Any questions from the board?
I think that's a good sign, but we'll see. Okay, Julia.
I don't have a question. I just want to thank you. That was a great, it's reassuring to know how much you guys are thinking this through and that you have a plan. And I really appreciate all the work you put into just preparing this for us. So thank you.
We're excited. It's a very exciting opportunity. Sheriff Phillips. Oh, you're on mute.
Sorry about that. Only thing I was thinking is, and I think the timeline will work, but for local governments, it would be better if we could award the grants more like in March so that we would have time to budget those revenues and expenses. Because most of us are going to be taking our budgets to our boards and commissions in May and June. So,
Okay, so that's really good information. I'll follow up with you, but it sounds like the earlier the better for notifying grantees. Okay.
yeah,
We'll keep in touch about that.
That would be better. Yeah.
Okay. That makes sense. We'll do our best. Commissioner Trieger.
Thank you. Yeah, and to echo, I mean, that's a great suggestion. A lot of nonprofits run on a July 1 fiscal year also, but a lot run on a calendar year. So people figure this stuff out all the time. I don't know if this is the time for it. I had two questions because when you ran through the first presentation about the structure, we said there would be some time. Are we going to go walk through those later point by point, or is this the time to ask some things about?
Yes, after the break, PRR is going to walk through all of these points with you so you can provide input, which will really, and then also they're going to go over every question from the survey where there was some disagreement. So yeah, each of those points, yeah.
We can dig into it then. So one of mine, I'll just say now, and then we can come back to it to discuss then, that sort of relates to this, is the idea that the funds have to be expended by a certain time as opposed to appropriated is a small concern of mine, depending on how the rest of things get structured. Because if people are trying to collect and amass and braid funding and have things in place or work to leverage, and they just can't get it done in time, if they're sort of, it's a more protracted project, I would hate to do that. And then what are we going to do about that if they say they can spend it and then they don't? We're going to take the money back. So that's sort of related to the timing, but also more related to one of the really specific questions. So we can talk more about it later.
I appreciate that. That's something we definitely have to put thought into, whether or not to allow carryover and what that can look like. And really, you get to decide. So we can work with anything. So thank you for that.
It's just the funding environment is so mercurial. Not only is it
Yeah.
contested, that I would hate to put somebody on the hook and then undercut them with a
Hmm.
relatively arbitrary deadline, frankly.
And we're assuming grantees will all be braiding funds in some way. That's just how it is right now. Yeah. Another thing we've been talking about with OCMP is how to front load these grants as much as possible and just get like, for example, 75% to the grantee right at the beginning of the project. We've heard a lot from community partners that so many of these orgs might be on a shoestring budget that they really need that initial infusion. And we've also learned that through the NASHP toolkit for working with CBOs. I know it won't be just CBOs, but these are ways that we're looking to make this an easier process on grantees.
And we'll dig, as Lisa said, much more into the details following the break. And there'll be lots more opportunities to ask questions. But I think we are right at our break time. If you would like to take that now, Annalise, we might make this decision live. We could also talk about the subcommittee first and then go to our break. Do you have a preference?
I responded to you in the chat, so I guess we'll do this live. I think it makes
It's
more
not updating.
sense to answer some of these questions and talk about the subcommittee later so that the board kind of understands what decisions the board is making and what will go to the committee to figure out. That's my preference. But if folks want to talk about this subcommittee idea now, we can do that as well.
Let's go ahead and take our break then, and then we will resume in 10 minutes, which would be at 11:03. All soon. Everyone should be back. I see Joanna's just joined us. At least I think we're ready to get started. Do you want me to just move straight into the survey?
Yes, that would be great. Thanks, Jenny.
Okay. I think we can go to our next slide. So thank you again to everybody who participated in the questionnaire. As Annalise said, your responses are going to give important direction to OHA on how to structure the RFGA and other decisions. So we are going to, in this presentation, start from where there is the most agreement from board members who took the survey, and then we'll move into areas where there's more variety in the responses. And for each question, we'll ask the board to come to an agreement either on the question itself, or if this is the kind of question that you would delegate to a potential working group to make a recommendation to the board. So as Lisa mentioned, there are a lot of decisions to make. We may not get to all of them today, but we're devoting essentially the rest of the meeting to this today. If it seems like the discussion on any one issue is getting too far into the weeds, I may ask you if it would make more sense to have that be a decision that you delegate to this potential working group. So next slide. Where there's general agreement, and it's not always unanimous. In fact, it is even where there's a lot of agreement, it's not unanimous. So plenty of room for discussion here. But among the board members who responded, there was a nearly unanimous support for allowing all types of organizations to apply other than state agencies, who, as Lisa mentioned, would not be eligible in any case. Do you have questions for OHA about what it meant with this question, or what does it mean that all types of organizations can apply? Not seeing any hands. So there was one person who did prefer to put some restrictions on who can apply. I'm wondering if anyone would like to make a brief case for restricting the kinds of organizations who can apply. Okay. In that case, oh, Sheriff Phillips.
It wasn't me, but I guess the case I could see is if we limited the types of entities that could apply, it might make it easier to select because we might see fewer applications. That's the only case I can see.
Okay. Rick?
And I frankly don't remember what I answered on this. So if I was the one no, I'm just have no idea. But the argument I could think of is reflecting on the first burn allocation. So it'd be useful, I think, organizations that have annual audits and can, the issue in the first burn allocation, and because I'm not a state agency, I can just say things, but well intended, but often funding was given to people who were ill prepared to take it. And so there were instances where they, were able to rise to the occasion, and a number of instances where they weren't able to rise to that occasion. So it would be, I think, useful for us to not so much limit what type of organization, but in terms of CBOs, what the qualifications that we're looking for in that type of organization, that they can show fiscal responsibility, organization, ability to stand up these things, that sort of language.
So, not necessarily advocating for restricting the types of organizations that can apply, but maybe potentially adding sort of like fiscal health and capabilities to the criteria and when thinking about evaluating organizations. Lori?
Thank you. Rick, I really appreciate you bringing that up. And I'm not sure if what I'm about to say sort of supports what you said or flies in the face of it, and I also don't want to derail the first slide. And here we are having a big conversation, but I think it's important to talk about this. As I recall, one of our values is to create a really low barrier to entry opportunity for people to get funding. And for CBOs in particular, absolutely yes, we want to be able for them to articulate their capacity to manage funds and their readiness to actually use them. But I also really want to make sure we don't fall into the trap of we've defined what professionalism looks like, or what, because a lot of the emerging practices and a lot of peer-led organizations have the capability and have been managing funds, but don't fit neatly into those boxes that more traditional structures of proving that might look like. So I think it is important that somehow in the application process, there's a way where they get to demonstrate what their systems in place are, what their capacity is to manage the funds, and their readiness to spend them. But I really want to make sure we don't frame it as if we've already decided what professional means and what that looks like. And I know a lot of CBOs are really challenged by the cost of an audit, let alone whether they've passed one or not. So I just want us to walk that line and not just be another entity that creates a barrier to some really important, innovative, truly grassroots, effective organizations having access to funds.
Yeah, it sounds like it will be important, as Lisa said, in thinking about the structure of the RFGA, to make sure that that priority of that low barrier to entry is upheld, while also, as you said, walking this line of fiscal responsibility.
And
but
that some
I'm
of the
not.
technical assistants speak to that too.
Yeah, exactly. But I'm not hearing any objections to.
Hey, Jenny.
Yes.
Oh, I just wanted to chime in. Thank you. I appreciate this debate. I do want to say there are certain parameters that they will absolutely have to meet just for legal contracting or agreement purposes. So, for example, they have to have insurance and provide proof of insurance. They have to have some kind of designation, whether that be corporation, nonprofit, LLC, they have to show compliance with these requirements, but they also have to not be on a list of parties excluded from federal procurement or non-procurement programs, et cetera. So there is a range of stuff that they'll have to meet. So, for example, a CBO would have to have a fiscal sponsor if they don't have their own 501c3 status, et cetera. Obviously, we can add more on top of that as needed, but that's the baseline.
Thanks, Lisa. Yeah, I don't want us to get too in the weeds on that right this second, because there will be time to talk about that later. But just thinking about this very initial decision about allowing all types of organizations, with the exception of state agencies, to apply. Are there any objections to moving that forward as direction to OHA? Not seeing any objections. So I think we could go ahead and say that OHA is going to, in developing the RFGA, consider all types of organizations, with the exception of state agencies. All right, let's go to the next one. Okay, so this question asked board members to consider if they preferred only funding the core strategies of Exhibit E or any Exhibit E strategies. And just as a reminder, the core strategies in Exhibit E are, I'm going to put them in the chat. So naloxone, medically assisted treatment and other opioid-related treatments, care for pregnant and postpartum women, expanding treatment for neonatal abstinence syndrome, expansion of warm handoff programs and recovery services, treatment of incarcerated populations, prevention programs, expanding syringe service programs, and evidence-based data collection and research, analyzing the effectiveness of abatement strategies within the state. In this case, we had 4 board members who recommended only allowing the core strategies, and 9 who recommended allowing all Exhibit E strategies. And of course, in this case, we don't need to, for this particular decision, it's just about making a decision on core strategies versus all Exhibit E strategies. And we'll talk later in this conversation about which specific strategies to pursue. Are there any questions before we get into the discussion? Okay, does anyone want to make a case for focusing on the core strategies as opposed to all Exhibit E strategies? Adria?
Like Rick, I can't actually remember which way I voted on any of these questions, but the case that I would make is that I would love for this very limited pool of funds focusing on strategies that help the most people in the most effective ways. And the core strategies, at least at the outset of Exhibit E, were designed to be those strategies. So that would be the argument in favor that I could see.
Yeah. Any other arguments in favor? Lori?
Yeah, I'm really relieved to hear other people don't remember how they answered, but I'm pretty sure I was one of the ones that said I was in favor of the core strategies, in part because within the core strategies, all the different, prevention, treatment, recovery are all addressed. It's sort of one of the opportunities we have to create some parameters, some limitations, if you will, that aren't around geography, population served. There's a reason those were named as the core strategies, as Adria just said, in the original settlement. So the only reason I was in favor of it was it's so little money for such a huge problem. It's at least one way in alignment with the settlement to give us some guardrails that we don't have to wrestle with ourselves.
Would anybody like to make a case for allowing all approved Exhibit E strategies to be eligible for funding? Annalise, and then Julie.
So I do remember that I voted for core strategies. But since many of us have forgotten, I'm going to put a little asterisk on it. And in fact, I did put asterisks on many of my responses. I also like the idea of making the list smaller. And it might be that if the outcome of this is that we want broad strategies, but we want a defined list that is maybe shorter than approved uses. I'm just sitting here looking through it that if we could say core strategies and then maybe pick some approved uses to add to that list, because I see things, the approved uses example list is much broader. I think one of the things that the ADPC will offer to all of you in terms of what you prioritize is that there's just some things that might be good strategies that maybe in other states there's a need for, but we heard zero about them during our year-long community engagement, which I think tells us that like maybe these are good strategies, but maybe not the highest priority as a whole in Oregon right now. So I know I'm not making this any clearer. Maybe this is something that goes to the committee, assuming we want to have a committee or somewhere for further discussion to kind of narrow the list at least, is something I would advocate for.
Okay.
Annalise, can you give an example of something that's contextually not relevant in Oregon or less relevant in Oregon, but made it to the core strategies because nationally it's significant?
I don't think there's anything in the core strategies. I think when you start to look at the broader approved use, there are some things that like we just didn't hear of being a high priority, and I probably can't name them off the top of my head. The opposite, though, I can say, Oregon is just launching recovery schools. There's a lot of excitement around recovery schools. We weren't able to expand the way that we had hoped because there isn't funding. That's not in the core strategies as an example, but it is under approved uses.
Yeah. All right. You ready, Julie?
Yeah. And I do remember how I voted on this one. I don't necessarily remember how I voted on all of them. But I did vote for the allowing all, and I think the rationale was I just wanted to be as inclusive as possible. I don't want to rule things out if it's a good project. And I recognize the challenge of whittling those down once we get them, but that was my rationale, is just trying to make sure that we're getting great projects and not only, not limiting it.
Sheriff Phillips?
I kind of vacillate a little bit both ways, but I look and I see that direct treatment of opioid use disorder is not a core strategy. And so that has me a little bit concerned because I think that's awfully important.
So medically assisted treatment and other opioid related treatment is a core strategy. Is that what you're referring to?
I'm looking at Schedule B approved uses. A, treat opioid use disorder. So that seems pretty important to me.
Yeah.
The core strategies are sometimes summaries, are summaries of what's the main section.
Mm-hmm.
Yeah, so I'm wondering if direct treatment is under medically assisted treatment and other opioid related treatment. Okay, so I think this isn't, again, as Annalise said, a decision that you need to make today, but in theory, we're starting with the easier decisions and then getting to the harder ones. How do you all feel about, again, we're just looking for directionality here, sort of taking a straw poll for either focusing on core strategies or ensuring that all Exhibit E uses are eligible. Straw poll okay? Thumbs up if that's okay. Chair Phillips?
I guess in my mind, I would hope that none of these core strategies are exclusive of the other strategies. I would think that it's all part of a really important continuum.
Mm-hmm.
I would think that anyone could present a grant application that has a core strategy identified, but also includes as part of that the other strategies or approved uses in Schedule B.
Yes. I think that's true. Okay, so I'm going to ask for an informal vote, just to again give some general direction to OHA. So after hearing that explanation of either folks who were arguing in favor of ensuring all Exhibit E uses, or board members who were recommending focusing on the core strategies. If you would like the RFGA to focus on core strategies, if that's your recommendation, please raise your hand or use your reaction button to raise your hand. Four, five, six, 7, 8. All right, looks like we have 7 hands raised and Chair Phillips clapped. So, oh, okay. I'm counting it. So if you would like the RFGA to ensure that all Exhibit E uses are eligible, raise your hand or use your reaction button. Right now it's looking like 8-5. So it looks like there's majority interest in focusing on the core strategies. In general, is the board okay with moving forward with that direction to OHA? Okay. All right. So moving forward with the core strategies. Okay. Next one is about that question that you had, Lori, around whether awardees should be required to spend all of their award by the end of the next biennium, so by July 2029. Essentially, that would give them 2 years from their award date to use the funding. In this case, there was broad support for asking grantees to spend their funds before July 2029, but about a third of you disagreed. So, Lori, do you want to go ahead and just say more about this question?
Sure. I think an explanation, is something of will your funds be expended by, if not, explain. I would want them to be appropriated, right? So not just like we're just getting some money and we'll figure out how we're going to put it all together later. But there definitely are projects, again, because of the braiding, where they might know they're anticipating something else and the timing just doesn't align, or it's, just sometimes the nature of projects doesn't always line up. And I would hate for someone to have check every single box except because of a match or another opportunity that they're assured of being misaligned with the timing. That's the only reason that they don't get the money. That just doesn't seem. So I'm fine with saying the expectation is, and if you can't meet it, explain why, or by when could you, and figuring out a way to accommodate that. So I'm not suggesting it should just be open ended, but I don't want to to place a restriction on somebody in an instance like that. And it sort of connects to the whether people can use it, for example, for capital, right? If we allow it for capital building renovations or something like that, those are multi-year projects, and they might know that they have other restricted funds they need to spend down in a timeline, understanding that ours would kick in for that last mile later or something like that. I would just hate to put that kind of limit on it, but I would want an explanation of why they can't meet that.
Yeah. So Fernando and then Joanne.
Yeah, I just wanted to kind of echo what Lori was saying. I think that requiring all the funds to be arbitrarily spent by day is a great way to ensure waste, because it forces people to just go out and start wildly spending money to meet the deadline rather than paying it back to the fund. So with a discussion, like Lori said, around it needs to be allocated. If it can't be spent, why not? And when will it be spent by? I think is general guidance as you guys work on the language for how it's going to read.
Thanks, Fernando. Joanne?
Thank you. And I appreciate the comments that both Lori and Fernando have made. I, I have a question, I guess, about as a board, is our expectation that we really would prefer to have them the funds spent within, by the end of the biennium. And I've heard yes, but we should have an option. It would be really nice to know if generally our expectation is that we would like to have the funds spent during the biennium. And what we have done on previous grants is to be clear about whatever the expectation is, but then to allow an opportunity for if it appears that it could be extended by request rather than doing it out front, where if we think we really do want it spent by the end of the biennium, I don't think we should open up that caveat in the very beginning, because then that allows then probably more of the folks, the applicants, to say, oh yeah, we would really like to do it, but we're asking you to approve an extension up front. So thank you.
Adding some flexibility later in the process. Courtney, do you have a clarifying?
Yeah, hi everybody. Courtney Fultner, she, her pronouns, Overdose Prevention Program Manager at Oregon Health Authority. Our contact from the Office of Contracts and Procurement is not here, but I'm just flagging that this might be something that we would need OCMP consultation on in terms of like the contracting and the ability to carry over and how we would work that into the RFGA. And so I don't mean to disrupt the conversation, but I did just want to flag that this may be something that we can continue the conversation, but OCMP might need to weigh in on in terms of like feasibility and how that would actually look.
So we can get direction from the board, but we'll have to also get direction from OCMP.
Yeah, that's right. Thanks, Jenny.
Rick?
Yeah, as a provider and a CEO of a nonprofit agency, I like Joanne's suggestion. Certainly, we've received funding for capital projects that I thought were slam dunks, shovel ready. We have the property, we're moving forward, and stuff comes out of the woodwork. It's a big to do, and it just, years, there'll be suddenly a delay of a year. It's amazing how unpredictable things can get derailed, and sometimes you do have to give the money back because it gets derailed, or sometimes you can work it through if you have some grace from the funder to work that through. There needs to be a communication going back and forth. I think Joanne's idea of not putting that out in advance, but if you do get stuck, there is a means for communication about that.
So far, what I'm hearing is a lot of support for adding that flexibility that Lori, you were talking about earlier, but making clear that the expectation is that the funds are spent by the end of the biennium. Lori, did you want to add anything?
Thank you. Yeah, I mean, absolutely what Rick just said, right? Stuff comes up. But it goes to something I saw in the comments on the survey respondents about covenants that are placed on OHA funds. And I would assume these are not subjected to that because they're not actually OHA funds, they're settlement funds. Is that right? Because that's another reason that has interplay with this issue of extension. But so that hopefully is a simple to clarify question.
Turn that over to OHA.
I'm sorry, can you clarify that,
Yeah.
Lori? Yeah.
There are often with state funds covenants put on. You can only spend the funds on this particular thing for the next 10 years. Like CDBG funding comes like that. We have OHCS funding at the county. We purchased a building and it has to be used for the purpose that we applied for the funds for a minimum of 10 years. So if we didn't use it for that purpose for the full 10 years, we'd have to pay back a prorated amount. And so there was a response in the questionnaire about whether covenants like that apply. And but I would assume they do not, because these are not state funds. These are settlement funds being run through a state agency. But
That's definitely an issue that we ran into with the OTP expansion. There, for purchase of real estate, there
Right.
is a restrictive covenant in place. But Annalise, were you going to add insight to that, or was it something else?
No, it was
Oh,
that.
okay. Yeah. Yeah.
And folks might remember OHA came to talk to us about doing rulemaking of the restrictive covenant, and they recently held a community engagement session. And what's being proposed would apply to not just capital purchasing. It would any capital, so it would be leases. They even mentioned considering attaching it to vehicles at the community engagement session. So that I think we should probably assume that would be a factor.
And I will just note, I mean, just noting that our next question is about capital expenditures and direction from the board around capital expenditures.
But this relates in my mind. I guess if a covenant is going to apply, we have to be really clear of when does that clock start ticking. Is it with the award, with the first expenditure that you book against these funds? Because we don't want to put people in a place of precarity that we didn't mean to.
If the board decides to allow capital improvements, we would probably have a whole group like investigating the parameters of that to make sure that the subcommittee is super clear on it. Tammy, I see you had your hand up. Was it about that?
It was just about the classification of the funds. I just wanted to provide a little bit of a fiscal background that these funds are held in state, state coffers. They're considered other funds. They are not general fund. They are not federal funds. They are considered other funds, but they are still subject to the same rules and requirements when we're going forward with contracting through our state processes. So I just wanted to provide a little bit of clarification there. Thank you, Lisa.
Yeah.
Yeah, and Annalise mentioned this question of vehicles. In the first round of funding, we were able to allow vehicles as a line item, for example, by the new recovery community centers. I don't know if that's changing or if it has changed, but great question.
Okay, so just to bring us to our little straw poll moment for this question, what I'm hearing, I haven't heard anything uh, that is arguing for just letting people be able to spend the money indefinitely. What I'm hearing is that we would I'm sorry, what I'm hearing is that the board is giving direction to OHA to set an expectation in the RFGA that funds would be spent before July 2029, but that would add flexibility if people needed, or for whatever reason, to spend funds after that date. Is that right? Okay. So if that's the direction that you would like to give to OHA, please raise your hand.
I'm sorry to interrupt, Jenny. Just about language disbursement via or versus expended. Typically, the restriction on our end is about when the money has to get out the door. And so, for example, if we say the just a random number, the final 25% of your award, you can invoice us for it upon completion of your work plan activities. So that means OHA has to pay the grantee by the end of the biennium, but they would, they're still going to have to spend that money, right? So it's really about dispersing, getting it out the door more than expending.
Thanks for that clarification, Lisa.
I'm sorry, can I ask, that was a not clear, that was a confusification more than a clarification.
I know.
Saying that the July 29 deadline then refers to OHA getting the money out the door, or
Well,
rather
we
than the
asked
grantee expending it?
just a yeah, I know. Thanks. Sorry about that. So random example. So let's say your last disbursement will go to you upon completion of your work plan activities. Well, they expended funds to complete those activities, and so they would probably be backfilling it, right? So let's say they completed all their activities on June 30th, end of biennium, and then we disperse their funds, once they invoice us. So let's say in July. Well, they still are going to spend it maybe for things that already occurred, but they're not going to have it all expended. You know what I
Right.
mean?
Well, yes, because the model you're describing is a reimbursement program, and that means they have to have the money before we give it to them. And I didn't think that's what we were talking about setting up. So
Yeah, and so that's why we try to front load it as much as we can. And as we talk to OCMP, we're talking about how much can they receive in advance versus the end of the project. So we're going to try everything we can to front load as much as possible. I'm not sure how much flexibility is there. We're still figuring this out, but I absolutely agree that we should try to not have to reimburse, right?
Right. And that's what I mean by appropriate rather than allocate their
Yeah.
funds. They have to have committed this is what they're spending them on.
Yes, yes.
Thank you.
Tammy, I hope I wasn't wrong with that. Please correct me if I was.
Okay.
I would agree.
So,
Agree. Sorry, thank you.
all right. So the board direction is exploring opportunities that allow flexibility if they need it after the end of the biennium. It sounds like OHA needs to explore further what the rules are in place around this. But I'm hearing from the board this desire for both a balancing of flexibility and accountability. Is that right? Raise your hand if you object to that framing. Okay. Seeing none. OHA, do we got that? Balancing flexibility and accountability on disbursements of the funds within the rules.
Yes.
Okay. All right. Next question.
So Jenny, on
Yes,
that
Rick.
last thing, normally your summaries are amazing and fantastic, but to say our conclusion is we want to balance flexibility and accountability is like, well, we want to support motherhood and apple pie. Yay. So maybe that's all we can do, but there's no specificity to that statement.
Would you like to add specificity, Rick?
I do not want to replace your job. I do not want your job. I don't know how you do that. So it's not a critique of your job. It's just like, well, we haven't given any direction to the state employees with that, and maybe that's the best we can do.
What I'm hearing in terms of direction is, and Annalise, you have your hand up, but yes, set the expectation that the funds be spent before the end of the biennium, whatever that means to OHA, expended, spent, and also allow for flexibility if people need extra time for whatever reason to account for circumstances. Annalise?
No, I think what you said, Jenny, is great. I was just going to suggest we do another straw poll so that we
Okay.
can have, because I'm not clear if folks agree on that or not.
Okay, let's go ahead. Yeah, thank you. Adria, did you have something to say before we do the straw poll?
Yeah, I just wanted to say I liked what Commissioner Trigger said earlier about asking for providing the expectation that funds are spent within the biennium, but should they not, but allowing for what was the word? Justification
Mhm.
if that was not feasible. So requiring some sort of communication from them as to why it was not feasible and the justification for that.
And I think that could be an ongoing thing as they're reporting. Like if there's a midway report, has the expending gone as you anticipated? Do you think you'll be able to meet the spend down? If not, why not? It's not only upfront because of the kinds of delays as Rick brought up, right?
Yeah.
You get some construction delays, some supply chain issues, some staffing, unanticipated staffing gaps, and then it takes a while to hire back, those kinds of things.
Thank you.
And I would like to say, sorry to jump in, a part of our program monitoring as agreement administrators is requiring periodic expense reports to hopefully catch this issue earlier in the process and to give the grantee time to pivot as needed, whether it be with the work plan or timeline.
Okay, Joanne, and then we'll do our straw poll. Oh, I can't hear you, Joanne.
Right. Of course you can't because I had myself muted. I put a comment in the chat that might help to clarify in that if we just offer an option that allows for extension on request, I mean, if they're not able to meet the timeline, on request for extenuating circumstances. And that way, then it isn't out front. It just is an option that's available, and it could be in the grant description that says, yeah, it could be upon request for extenuating circumstances.
Okay. Zeb, do you have anything to add to that?
Yeah, I'd like to add. I like that idea. I mean, because we're going to be, reviewing the applications, and people are going to be submitting them with a plan to spend these funds out. We have limited funds to send out, so this money needs to be effective. So, I mean, Lisa, you already brought up too. I mean, we'll be able to track along the way where they're at on their spending, if they're on their timeline or not. But people should expect to spend this money by the end of the biennium. And then, unless there are some type of extenuating circumstances, I just don't want people or organizations thinking, well, kind of go back to human nature, be like, oh, well, actually, we can go past that. Really, I mean, we don't really have to meet that. I want them to really be organized. So, thank you.
Okay, so it does sound like we're all sort of coalescing around this idea of setting the expectation that funds are spent by the end of the biennium, but allowing some sort of extension based on extenuating circumstances. So if that is the direction that you would like to give to OHA, please use your reaction button to raise your hand. Okay. Looks like everybody is thumbs up on that. Thank you. Okay, next question. These were the easy ones, guys. Can you share the
Sorry, so
slides
yeah,
again?
sorry.
Yeah.
One second, working on it. Don't know why the slide closed accidentally.
Oh no. In the meantime, Fernando, Zeb, do you have questions or are your hands still up from the straw poll? Okay. So the next question is about capital expenses and allowing capital expenditures like buildings, vehicles, or renovations. Generally, the respondents preferred not allowing capital expenses. There were caveats in here, though, or asterisks. Is that how you put it, Annalise? Um, but this was more evenly split than the other questions. You can see that we had 9 folks who responded who did want the RFGA to allow for capital expenses, and I'm sorry, 9 who did not, and 6 who did want to allow folks to spend any awards on capital expenses. Julie?
Yeah, so I think I said no on this one because of the question, but I feel like vehicles I would be more supportive of if it's providing transportation for people to get to people that need services or to get people to services that need services. It was really the other aspects of the capital expenses that I wasn't supportive of. So I don't know if there's an ability to carve that out or do it, do it, clarify it differently.
Yeah, I don't know the answer to that. OHA, do you have an answer to that?
Yes, you get to decide what the allowable and non-allowable expenses are. So if the board really wants to make sure vehicles are allowable, we can work with that.
Rick?
So again, just my perspective as a program director, agency director is, so if we have putting out an RFGA for one-time expenses, but we not going to allow capital expenses, you sort of have program expenses or capital expenses. And do I want to put in an RFP for program expenses that disappears? It's not, it's one-time funding. So, I've come to dislike starting up programs and then closing them. If I know that's the deal, I'm not going to do it. That just is so disruptive to so many people. It's not worth doing in the long haul. So, um, one could, if you don't want to put in buildings, you could put a limitation on the capital expense so that it could be maybe the last mile on a capital project that you've put together. You still need 250,000 to close it. That might be a different thing than saying, hey, we will spend $1.5 million on one building somewhere. So that may be a way of sort of splitting the difference. But again, from a program director's perspective, when I'm looking at a grant, and you say this is one-time expenses, but there's no capital expenses allowed, I don't know what you're doing as a grantor at that point.
Yeah, you're pointing out that there's tension between this direction that these be one-time expenses and this idea of not allowing capital expenses, which are one-time expenses. Does anyone else have anything to add to that? Lori?
Yeah, I think it's also, I think our tendency when we hear capital expense is to go to big ticket, buy a building. But a capital expense can be a small, installing security cameras, providing reinforcement and locking to a closet where medications are stored. It can be the line between equipment and capital is different. But I just, like Rick said, it's, it really helps because this is one-time money. To why would we not want to allow people to use it for one-time expenses, which are often classified as capital expenses? And again, because of the scarcity and the mercurial nature of funding right now, if somebody wants to use it for general ops because they know how hard that is to come by, they know that best. So I just, yeah, I don't. So I would like to hear from somebody who wants to disallow to make that case, because capital expenses can be small but super meaningful.
Chair Phillips?
I guess my concern, and this does go to the larger conversation about the value of one-time funding versus more strategic true investment. But I wonder what the community expectation is, and what they see as being effective use of these resources. If at the end of the day we bought a bunch of cars and a couple buildings, did that really provide the treatment and change people's experiences, or did it buy some cars and buildings?
Yeah. Julie?
Yeah, thank you. This conversation is helpful. Like I said, I was just going off of the question and the examples in the question, and my gut was kind of what Sheriff Phillips was saying, is like, well, no, we shouldn't be spending our money on buildings and renovations of buildings. So I think if we can define what we mean a little bit more with capital, and I like, Lisa's suggestion of major equipment, or like defining it differently, so that, yeah, if there's capital costs that will help the program be more successful, I think that's great. I think using money, just hey, I'm city manager. I get people saying we're wasting money all the time, but spending money to renovate an office isn't probably, isn't going to sell very well. So I think, of course, it probably wouldn't score very well either, so it might be a moot point. But so I think if we could clarify it, I would definitely be supportive of capital expenses if that makes sense.
Okay. So there's some interest maybe in having a potential subcommittee work with OHA to define a subset of allowable capital expenses, potentially. Skylar?
Yeah, sorry, I've had to be a little in and out of the conversation, but I just wanted to say something similar to what has been said. I said yes to this question, but I'm a little bit on the fence, honestly, and I normally are on the side of as many allowable uses for government dollars as possible to give as much flexibility to grantees or providers or contractors as we can. But I do think, and it's been said in previous meetings, money goes really, really quickly with capital expenses, and I think that was just in the back of my mind of, one building could be this amount of money. And so if there's a way to put parameters on that and then still give flexibility to the grantees, I would be really interested in that and just wanted to name that. Thanks.
Thanks, Skylar. Just noting that there's a comment in the chat about what the capital investments for OTP expansion were able to do to allow expansion of treatment in areas of the states where previously didn't have that. Sheriff Phillips?
The other thing I was thinking about is if we were looking to desperately expand capacity, create new programs, I think it'd be more in favor of capital expenses, or are we thinking that we would like to support existing providers be more effective and efficient with their programs? Then I would say no capital expenses.
Yeah. Fernando?
Yeah, kind of like Skylar, I'm a bit on the fence on this one. I'm concerned, especially at a moment where we know contraction to the service system is coming through HR1, that investing in objects instead of people to provide services may not be the best use of this dollars. And I recognize that in some of the underserved areas, some capital investment may be necessary. So I would support it if there were some kind of upper limits on what can, like, basically the work group to decide what counts as a capital investment under these dollars or what's allowable. Because again, it's not that much money. It's going to get smaller. Also, we allow a capital investment. The CPI, the consumer price index is growing, inflation's going up. All of a sudden, what they requested is not enough to build the project. And then money that could have been used more directly is now just kind of in a sort of bureaucratic holding system and operational. So I think for the ease of you for actionability, it might be better to really consider exactly how we're saying capital investment can be used with some guardrails, some serious guardrails.
Yeah. And you're saying that might be a role for the work group.
Right.
Okay. Rick?
Yeah, I think if we could get to a consensus with what are some guardrails for capital expenses, I think that would be good. Again, just as a CEO for 30 years of a nonprofit behavioral health agency, it's like if you show me this RFP, I will, the only program expenses I will go for are programs that are losing money that I don't want to close, right? But I'm not going to hire people on funding that's going to disappear in 2 years because that's just too disruptive to too many people. So I might backfill programs that don't have funding and continue those jobs for a while. But and that's sort of the calculus you have to make. But I think if but the idea that we have these limited funds and we're going to buy a building somewhere, well, you'll eat it up so quickly. But if there's some guardrails around a capital expense that we can agree on, and so you're not spending huge amounts in any one project on a capital expense, but it could be a top out or it could be, how you finish a project. I would support that.
Okay. Thanks, Rick. Annalise?
So I could go either way on this. It does concern me that it's been a major barrier with the capital investments that we've made so far. The reason why they're not out the door is in part because of the restrictive covenant. So I'll just say that for me is a caution, like given that we want this to be like a one-time infusion into the system. I think this is maybe the only one-time funding. Maybe we'll do some in the future. I don't know. So that I'm just saying that makes me a little nervous. I'll go either way. I would only vote yes for this if there is consensus that there will be a cap, because I think we would have a very angry public if we only funded 2 projects with this. So I'm hearing consensus on that. So I just want to throw that out there. Jenny, if you whatever you come up with for the straw poll, if it can have that piece in it, that there will be a monetary cap. We need to further define what capital means in this context. I think then I can vote yes for it. Otherwise I can't.
Yeah. I think that it sounds like what you are coalescing around is having the subcommittee work with OHA to define those parameters around allowable capital expenses. Does that resonate?
As long as it is with a monetary cap. I think that needs to be a part of whatever we vote on, is that we are giving direction that some capital could be allowable, but it has to have a monetary cap.
Okay. And that would be defined that would be part of the subcommittee's work, or the work group's work to help define that. Okay, so we are saying that the subcommittee would work with OHA to define a subset of allowable capital expenses and set a monetary award cap for capital expenses. How does that sound? Seeing some head nods. All right, let's go ahead and look at faces. Okay, so if that is your direction to OHA, please raise your hand. Fernando, Rick. Fernando, you had already raised your hand physically. Okay. Are there any objections to that? Sheriff Phillips, you're noting an objection. Any other objections?
I guess I'm not completely objecting. My
Yeah.
baseline is no capital expenses. But
Okay.
if it's a number like $50,000, I could be pretty comfortable with that. Or maybe
Okay.
$100,000. But if we go much over that, I'd be uncomfortable.
Okay. Carrie, do you have any thoughts?
I don't know if I have anything that is useful to add to the conversation that hasn't already been said.
Okay.
I mean, I feel like there's no real right answer for me, just being transparent. I think about, the thing that I will say from my perspective is that when we are receiving one-time funds, we tend to not hire new staff. So if we can use it to backfill existing positions temporarily, then we will do that, as we're doing with some of the rural health transformation funds that we're getting, not necessarily backfilling, but use it to support existing staff to do different work. And so I think having some flexibility, I keep thinking about, I know this is so random, but I keep thinking about like MOUD and how there are certain like things you need to set it up in addition to staff. And so I think part of me wants to like include that flexibility so we can really let communities and organizations and people doing the work tell us what the needs are so we can respond to that, but also like recognizing that it would be helpful to narrow things down so we're not having to weed through all of those details. So I don't feel like that's really helpful. I think I'm on board with whatever direction we decide.
Okay. Well, it sounds like Seb, did you have something to add?
Yeah, I just want to like let Sheriff Phillips know that I'm of the same thinking you are. It's not like lots of capital investment or something, but like what in line with your thinking is what I'm thinking. So.
Okay. So the direction was that the subcommittee would work with OHA to define a subset of allowable capital expenses and set a monetary award cap. Some numbers that have been mentioned around the monetary award cap are like $50,000 or $100,000. That's something that the work group can work on at a later date. All right. We have the last of the easier questions coming up next.
Jenny, Lori has, yep.
Thanks. I just wanted to say I appreciate Sheriff Phillips putting a particular number out there, but I'm hoping the subgroup explores a broader range, because that's not very much money for something like retrofitting a space to provide service or something like that. So I'm assuming, I just wanted to say that, since the only number that got put out there was a pretty low number.
Yeah, that'll be, I just reiterated that for the notes, but that's a question. It sounds like the board is delegating to a potential work group.
Thank you.
All right. Okay. So this next question is around some mechanism to ensure that the RFGA would support work across the substance use disorder continuum. So that would include prevention, treatment, and recovery. Just reminding everyone here, Tammy, you mentioned this earlier in your fiscal update, but the board has already allocated over $5 million from the 2025-2027 biennium to harm reduction. So there was broad support, not unanimous, but there was broad support for the RFJ or the RFGA having a mechanism to ensure that each of those prevention, treatment, and recovery parts of the continuum were funded. The example parameter that was put in this question was something like minimum funding amounts for different parts of the continuum. So are there any clarifying questions for OHA about what they meant with this question? Are there any objections to directing OHA to create parameters to ensure projects across the continuum are funded? Or any nuances to add? Joanne?
Well, my concern is that we cannot guarantee the types of applications that may come forward. And by mandating minimums in specific areas, I'm not sure what we would do if there were not sufficient applications in across the entire continuum of our available funding buckets. So that was the only thing that I was really concerned about, is that we may have a preponderance of them in one area and none in some of the others. And how would that be handled?
Thoughts on that?
I believe our OC and P liaison, Stephanie Morgan, is here. Stephanie, do you mind chiming in?
Hello, good afternoon. This is Stephanie Morgan. Yeah, so I think in that circumstance, we would just need to include some language in the RFGA that, a backup plan in the event something like that occurs. We might also be able to add some flexibility with the language with that in the RFGA, such that, if you put the minimums for each, those can be flexible, based upon our discretion when we're evaluating, if that makes sense. So if we put a mandatory minimum of 4 million towards prevention, at our discretion when we're evaluating, we can reduce or increase that amount at that time.
So Stephanie, you're saying there is potentially a mechanism to address that issue. Okay.
Mm-hmm. Yeah, we can put some language in there. If there is no one who applies in a certain area, but I think somebody mentioned earlier, we anticipate a lot of responses. Speaking to some of my colleagues, to some of these, they are receiving hundreds of responses, 300, 800 responses. So hopefully we can get, some folks who are going to respond to all the categories.
Yeah. Julie?
I appreciated Joanne's comment, and I'm just wondering if I'm more thinking of a situation where you get a few, but they're really not great, and maybe having a minimum funding if you score over this amount, like, so that we're not, having this real rigorous, only the best of the best in one area, and then things that aren't very solid. So maybe having a baseline of, qualifying scores or something like that in the criteria. And on this one, maybe I do need clarification. I think I voted yes on this because I think that I thought it was asking like, if as long as we have parameters, we can provide minimum amounts for things within those parameters. So I'm continue to be focused on that geographic um, dispersity. That's not the right word. So like regions or, something like that. So if that's not what we're talking about, I guess I'd like to get clarification on that as well as an option, not necessarily deciding that that's what that would be.
Yeah, there are later questions in the survey that talk specifically about set-asides and priorities. And I think that's where some of those questions about geographical representation come up.
Thank you.
Yeah. Joanne?
Well, I forgot about just mentioning one other thing that I wondered about, and this is more a question than it is, say, a sense of a priority. But how and when would we deal with grant applications that identify more than one of the funding parameters? So, does it get pulled out of one bucket and put into another bucket, or how do we deal with this? Because my sense is that a number of these grants or strategies could meet more than one of our funding parameters. So it's more of a question.
I wonder if OHA, if Courtney or Lisa, you have some clarity to provide about what you were thinking about in putting this question together, and what you were thinking about in terms of these predetermined funding parameters.
Yeah, we were
Denise.
thinking. Oh, go ahead.
Go
No,
ahead,
no, you
Lisa.
go, you go. Go, go, go.
Yeah, so what we were thinking is asking the applicant to select where their proposed project like fits within the continuum, and if it's multiple, for example, a treatment and recovery project, we would have it assigned as a treatment and recovery project, and then when we kind of have all of our final scores, like ordered by number, for those projects that have either treatment or recovery, say we have no recovery, they would get kind of like placed in order. And then if we have a $100,000 minimum for recovery, for example, once we kind of reach that cutoff of our like available funding, if there are no projects that had kind of checked that box for recovery, we would sort of reorder the list to ensure that at least one project that has selected recovery components receives funding. I know that that's like a very complicated way to describe it, and we could probably provide a better presentation to the work group at a future date. But it's just kind of like self-selecting and then ensuring coverage based on the scores.
Thanks, Courtney. Fernando?
Yeah, it's just kind of just trying to logical question. If we're already saying that it has to meet the core element, the elements of Exhibit E, doesn't that of necessity require some sort of amounts for each of those core competencies at that point? Isn't this question kind of answered by that question?
Well, it's flexible in terms of we could designate a specific number of awards per strategy rather than amounts, but we don't want to limit grantees to only being able to implement one strategy, right? Because especially smaller organizations tend to work across the continuum, so some might be checking multiple boxes. So we definitely have to think that through. Courtney and I are on the same page as far as maybe it makes more sense not to allocate a specific amount to each thing since there will be so much overlap, but maybe number of awards or strategies funded.
Yeah, because the other part is that I'm thinking is that if we allow kind of just like this a la carte picking of an organization, does that make their overall award larger? Can they say we're going to apply for this much for this much for this much for this much for this? And so there's that kind of like it brings up some other questions. The other question I had overall about this one is, what does the Alcohol and Drug Policy Commission state strategic plan say around resources? Because a lot of times we're saying allocate equally, but the system is not equally resourced across the continuum right now. And in fact, certain parts of the continuum can suck up pretty much all of the money relatively quickly. And so I think that rather than us just sort of together coming up, well, how about this? How about that? How about that? We use the guiding document that is the strategic plan that we should all be following. The state agencies should be following. So
Fernando, so you're advocating for rather than picking an arbitrary uh, saying something arbitrarily right now, really connecting this to the ADPC strategic plan.
yeah,
Sheriff Phillips? Oh, sorry.
no, you got it. Good.
Okay,
Yeah.
Sheriff Phillips.
I think echoing and supporting what Fernando just said, this is an opportunity for this board to be leaders and to identify what we need, instead of just putting it out for people to put in for what they want. So yeah, I'm with you, Fernando.
Okay, is this a question that it makes sense to delegate to the subcommittee to dive more into this? Some nods. I think one of the things that and maybe I'm misreading this question, but one of the things that I understood about this was that this was just a way to ensure that that funding went to each part of the continuum. Um, and that was the direction that OHA was looking for. Do we want to ensure that funding goes to each part of the continuum, or is that something that we want to, it might depend on the applications that you receive. Sheriff Phillips?
Well, just to kind of help me understand, I don't have a concept for how many people will be applying for these funds. And I imagine if it's a lot, then each of these, prevention, treatment, recovery is going to get touched on by some applicant, right? And then depending on the size of the awards, like if we did $500,000 awards, we could pass out like 27 of them, right? Is there going to be 100, 200 applications? I don't know. That helped me understand how to word this question.
Yeah, Stephanie might have a better answer than I do about that. One thing that I do see in here is that because OHA is required to follow a strict process, that means that the highest ranked applications get awarded. I think the worry was that there might be, I don't know, just assuming that there are enough, we can do 27 awards. If the highest ranked 27 applications are all in prevention, that might mean that treatment and recovery don't receive any funding. I think that was where the concern was. So, yeah, and then Courtney, I see you nodding your head there.
Yeah, that's right. Thank you, Jenny. Yeah, we would just need some predefined parameters around that, given the rigidness of our scoring and granting process. And so this would be a strategy to ensure coverage without providing very specific dollar amounts or potentially award amounts for each category. So allowing flexibility, but also having some sort of parameters to prevent the scenario that Jenny described.
Yeah.
Can
Joanne?
we just say not more than 50% of funding can go towards one bucket?
I mean, that could be the question was, do you want to provide a mechanism to ensure funding across the continuum? It wasn't stipulating a particular mechanism. And that, Sheriff Phillips, would be a mechanism. Yeah. Joanne?
I think funding across the continuum is a really wonderful idea. I hope that it is not being. I know that scoring and managing the application process is going to be difficult no matter how what the parameters are that are established. I'm hoping that the 10% across is not primarily a mechanism for scoring and allocation purposes rather than quality of project. And I'm going to go back to Julia's comment. I think I really agree with her that I would hate to see if we have very high scoring projects in some of the other areas that we don't accept those because we need to meet these funding allocations across the continuum. And, you know, I say that going back to the very first comment that I think funding across the continuum is important and it's a good objective to have. I think quality, quantity, really need to be the drivers. And the scoring may mean that we have some very high quality projects in other areas and they need to be funded. And this, I would hate to see that this locks us into funding projects that don't necessarily meet those other kind of criteria in terms of quality and and other priorities.
Thanks, Joanne. Stephanie?
Yes, thank you. So with regards to having, excuse me, I'm so sorry, the minimum dollar amounts, one thing we could do is like make a range of the dollar amounts and say we may award this range for prevention. I'm so sorry. Or may award this range for recovery and this range for this, and use the term may and make it flexible. I'm sorry, I'm just going to need a minute. Excuse me.
Yeah, thanks, Stephanie. I think what I hear you saying is that there is a way to add flexibility to this and not, to address your concern, Joanne, lock the board into, funding subpar projects because they, happen to be the highest scoring in a particular bucket.
Right. The other thing I was going to say to that also, Jenny, thank you, is, excuse me, if we had separate, and this is just an idea, separate scoring committees for each of the separate categories. In that way, they're awarding to the highest ranked in each of those categories, if that makes sense.
Okay. I'm not sure that made sense to me. If you want to try that again.
Yes. So,
Okay.
So for example, you have a scoring committee that is reviewing all of the recovery submissions. You have a scoring committee reviewing all of the prevention submissions, and your evaluation criteria is for specifically each of those components. So let's say you get 10 bidders in each of those categories, and you're selecting the highest ranked in each of the categories, not the highest ranked collectively of all of them together.
Okay. So using the evaluation committees as a mechanism to help ensure funding also across the continuum. All right, so it sounds like there are ways to provide flexibility, and I'm also hearing support for mechanisms that allow for funding across the continuum, and perhaps support for the details of that to be delegated to a working group. Does that sound right? Okay. All right, so if that's the direction that you would like to give to OHA, once again, please raise your hand. All right, we will do that. So you guys, that was all the easy questions. We have 9 more of these to do. We're not going to get through all of them today, but Annalise and I have been chatting furiously behind the scenes, and there are a couple that I think we do want to get to, which are this tier 1 and tier 2 question. And ideally, we're gonna have a hard stop at 12:45 so that we can make a formal decision on the subcommittee, because we've been referring to this work group, but it does not yet exist because you have not yet formed it. So 12:45 we're gonna stop, and we're gonna make a decision on, you are gonna make a decision on the work group. And that's going to, whatever we don't get to today, if you do stand up a working group, then the folks in the working group will move forward. Does that make sense? Okay, great. So let's bring up the first slide, Zach, that speaks to the tier 1 mini grants. Okay. So in our previous meeting, I'm sorry, in the board's previous meeting, you gave direction to have essentially 2 funding amount buckets, a tier 1 for these sort of mini grants and tier 2 for larger grants. And the first question around these tiered funding is how basically OHA is asking, if you have 13.5, now it's $13.7 million, how much of that $13.7 million should be set aside for mini grants? And there was a lot of variety in the responses, all the way from, $1 million, which is about 7.5%, to 40%, so a little over $5 million. And one person who replied preferred, rather than separating into these 2 tiers, just let the applications and the scoring drive the amounts. So the question is, I will just open discussion about how much of this $13.7 million should be set aside for these mini grants. Thoughts on that? Or is that a question you just want to directly give to the subcommittee? Sheriff Phillips?
I just have a question for the experts. As far as being effective, what's the best bang for our buck? Is it going to be mini grants? Is it going to be the larger ones? I just don't know.
Yeah, experts?
And the reason I ask is I just want to make sure that we're being effective and not necessarily reactive to, just trying to be generous or keep people afloat. Maybe Rick knows.
Rick is an expert. What do you think,
Um,
Rick?
well, I don't know if I'm an expert, but I'm experienced. My concern, mini grants are nice, but if your goal is to actually change the system, then they don't change the system. If your goal is to do small, innovative projects, then that can be okay. And I've seen mini grants implemented here in Central Oregon by an organization and, dealing in healthcare. And, healthcare is a multi-billion dollar system, even in Central Oregon. And providing a $10,000 mini grant does nothing. So that, but they're cool ideas. So it's really depends on what you're trying to do with your money.
Any other thoughts on the effectiveness of mini grants? Other people who are on the ground? Fernando?
Yeah, I kind of tend to agree with Sheriff Phillips and with Rick on this one that while I understand how meaningful this could be for an organization who is just trying to get through right now, it doesn't actually lean towards my previous comment around what does the ADPC strategic plan say we need um, to build the system that we hope to have. My concern is that if we over allocate in this bucket, that we could end up with a project not having enough money because that could be really meaningful and powerful, um, but it's going to be short $500,000 due to a mini grant. And so I prefer let the application scoring drive the amounts.
Sheriff Phillips?
Yeah, I was just going to say that I guess my gut feeling is that we still have a opioid crisis in this state, probably across most of the United States, and that we are a state level board. We'd probably be most effective if we focus on the large muscle movements, the big efforts, because I'm desperate that we make a big difference.
Annalise?
Well, I'll start by saying I wonder if we can hear from some folks who advocated for mini grants, because I do think coming into this reflects the fact that there did seem to be consensus about mini grants. So would love to hear from some folks who were in favor of that. I will say in terms of effectiveness, it depends. We have been able to leverage bits and pieces of money at the ADPC for trainings, we have some school pilots right now that are, I think, $25,000, maybe it's $100,000 total. It's like, they're very, very small grants in order to set up a model. So I think it depends. We have primary prevention community-based organizations running on a shoestring who would take $10,000 and run with it and could run like 1 to 2 years of a school program. So I think we all need to keep in mind, and I hear you, Fernando, and let the strategic plan drive this. But what the strategic plan tells us is that this entire system is not built on sustainable funding. So it's magical thinking for us to think that this is only going to be used for one-time funds, because the vast majority of services outside of treatment are run on a shoestring with non-sustainable funding. So if somebody who was in favor of mini grants could speak up to kind of what you're thinking, I'd like to hear what's the amount of the mini grants, because in my mind, mini grant is could be anywhere from 10,000 to 100,000.
All right.
Yep. Thank you, Annalise. Everything you just said, I just want to applaud and amplify as someone who ran a small nonprofit for a time. Particularly if we want to do geographic reach. Some of our communities in the far-flung regions off the I-5 corridor are tiny, and they're having proportionally as large an impact as really big visible organizations in bigger metro areas, and they don't need as much money. So I think dollar amount is just not as is not an indicator of efficacy of a program. And the examples Annalise gave are perfect, right? Trainings in a schools program does not cost a lot to put on a training, and then the impacts of that, the infrastructure that builds in terms of the knowledge and the connections that people established in trainings like that is invaluable. That is part of the system that we're trying to build. So much like with capital, it's easy to go immediately to the $10 million to buy a building place, but that's not always what people need. Same in my mind to a mini grant. So I'm a big supporter and have been a huge beneficiary in my time in the CBO space of mini grants. I think they're really impactful.
Sorry. Joanne, I know you need to leave soon.
Yeah, I do. I'm sorry. I wasn't going to really speak to this because I thought I did. I think I did on my questionnaire. Did support mini grants, and I'll tell you why. And that is very similar to Lori's and Annalise's thoughts. I don't. I mean, I think the concept of big and big impact is great. And whole, and I look at some of the area, and they are some of those communities. Cities might be willing to pick up ongoing costs for programming if they are able to see that there is some benefit. And maybe a mini grant as a startup might be the incentive that is to stay in an ongoing program or to incorporate it into some of their other processes. And I'm thinking about particularly the warm handoff because they don't necessarily have the capacity for providing ongoing treatment within the community or don't have those CBOs that will do that, but they do have access to more regional kinds of programs. And so I see it as a mechanism to fill in gaps where we just simply do not have services. Thank you.
Joanne, and I'll just add Lori in the chat, put in mini grants can be important match funding mechanisms. So a lot of really eloquent statements on behalf of mini grants. I wonder if you feel like in the next 3 minutes that you can come to a decision on how much of the $13.7 million should be set aside for mini grants, or if you think that this is a question that you would like the working group to address. Lori?
Thanks. I have a hard time naming an amount without seeing the whole elephant.
Yeah.
We name amount for this, we're by definition limiting the amount for other things.
Yeah.
And then the other thing in terms of amounts of mini grants to consider is instead of dollar amounts, percentage of general operating budget or something like that as another way to shape it, because $10,000 to an organization whose general operating budget is $500,000 a year versus $2 million a year is really different.
Yeah. So the whole elephant probably would take more than the next 2 minutes to provide. I will just, I think that this is a question that's going to go to the working group. I will just note that on the next slide, if you can show that, Zach, there was a lot of variety in what, I think somebody, I cannot remember who, I'm sorry, said, mini grants could be 10,000 to 100,000. And that's essentially what everybody said. These, when looking at the ranges or when you were recommending ranges for mini grants, board members suggested anything from 10,000 as a floor to up to 25,000 to up to 100,000 to up to 250,000. So those are very different amounts and have implications for, of course, how many mini grants you can award, and to your statement, Lori, about where that fits in terms of an organization's operating budget as well. And similarly for the tier 2 funding, that there were a lot of different ideas about how much of the funding should go to tier 2 funding and what the range is for tier 2 funding should be as well. All right. Is everyone okay for moving the questions that we didn't address today to delegating that work to the subcommittee, to the working group? Raise your hand. Okay, or thumbs up. Seeing lots of thumbs ups. Okay. So let's go to the question of the working group. Okay. So we know that that we've talked about in this meeting, and the board talked about it in your last meeting, about a working group to help provide more to really dig into the details that we've been starting to dig into today. And certainly one of the things that you mentioned in our last meeting was that the board meets monthly. Could be very difficult to achieve the timeline that OHA is hoping for and that the board is hoping for if we're just, you saw you addressed, I think, 5 of these questions in an hour and a half. So the board could decide to create a working group to provide recommendations on the RFGA process. Of course, the board, those recommendations would be brought to the board probably at the August meeting. The board will retain final recommendations and decisions on those board matters. And it looks like the subcommittee might be able to meet up to 4 times ahead of the August board meeting in order to dig into all of these details. In the survey, 7 board members indicated interest and availability to serve on such a subcommittee. So just to formalize it, is there interest in the board officially forming a working group to provide recommendations about the RFGA to the board? Okay. Would somebody like to officially make a motion? We do have some proposed language on this slide that you are welcome to use or to modify. Anybody like to make a motion?
I'll make a motion along the lines of the suggested draft from the staff.
So I'll read the suggested draft out loud, and then we can, before we ask for a second, see if there are any changes. So I move to establish an OSPTR board subcommittee that will be tasked with gathering information and making recommendations to the board regarding OHA distribution of funds allocated by the board. The recommendations of the subcommittee may be used by the board to make recommendations to OHA about the distribution of board allocated funds, including but not limited to recommendations for a competitive grant process, such as a request for grant applications. Any discussion on the motion as proposed?
Did we get a second?
We haven't yet. Yeah, that's the next question though. Is there a second?
I second.
Okay. All right. Let's call the vote. So, Amy? Is Amy with us still?
I'm not sure if Amy's allowed to vote. I don't think somebody can vote in someone's stead, but Shannon could clarify it if she's still here.
And I think Amy had to leave.
Oh,
Okay.
okay. So
So it doesn't
problem
matter.
solved.
Adria?
Aye.
Okay. John? Is not here. Sorry, he's on a plane. Tammy?
Aye.
Annalise?
Yes.
Zeb?
Yes.
Nick?
Yes.
Lori?
Yes.
Skylar? Is Skylar still here? Okay. Joanne had to leave. Julia?
Aye.
Carrie?
Yes.
Rick?
Aye.
Fernando?
Yes.
And Sheriff Phillips.
Yes.
Okay. All right. The motion carries. So we will be in touch with the folks who volunteered to be part of the subcommittee to start scheduling those meetings and yeah, asking about your availability. All right. I do not believe, but we'll ask Sarah Rose to confirm that we have any takers for public comment. Is that true?
Yeah, that's right. No requests.
Okay. So let's go ahead and move into next steps, which I can go through. Um, okay, so we said we'll reach out to board members who volunteered to be part of the subcommittee. OHA, you mentioned that you will be meeting, and you already are meeting with partners to shape the RFGA. One question that I had was this is a logistics question about our July meeting. So the board could choose to meet in July to hear a brief update on the work of the subcommittee, or the board could choose to let the subcommittee focus on moving the RFGA forward and reconvene in August to hear their recommendations. Are there any thoughts, any preferences for meeting in July versus not meeting in July?
It's not clear to me what we would talk about in July. I'd rather let the subcommittee do their work and give us more to talk about in August.
Yeah, okay. Any objections to skipping the July meeting, moving? Okay.
So I don't have an
Annalise?
objection, but I think I have a request
Mhm.
that I think folks will notice that on a lot of the survey responses, we ended up going, or at least on some of them, we went in a different direction than what the majority voted. So this board is so wonderful and takes such an active role, and it is amazing. So take this as nothing more than a compliment. I have a slight concern in the back of my head that we'll get to August and the board, might have objections to what the committee has brought forward. So I think if there are things that we didn't get to today that people have really strong opinions about, if you could reach out to OHA or reach out to me or Carrie or PRR and let us know what you're thinking so that when we get to August, we've got something that we will have consensus around. I think that would be amazing because we don't want to slow this down any more than we have to, but we want a really good product. So the input is very much valued.
Thank you, Annalise. And I will just note that the survey responses or the sort of a summary of the survey responses was included in your packet. A couple of people submitted responses after that was completed. So we can update that to make sure that those are included and send that out so that you know what essentially what the next questions are that the subcommittee is going to be taking up. Courtney?
Thanks, Jenny. And thank you, Annalise, for raising that point. And I think that another thing that we can commit to is since the subcommittee will be public meetings, we will be doing our regular meeting summaries. And so we can commit to sharing those so that the board can stay informed over written updates. And that would be another opportunity if you're seeing something, a direction that the subcommittee is moving in, that you have major concerns about, you can reach out to us at that point as well.
Thank you. And Shannon, I'm going to give you the last word.
Great. Just a gentle reminder about public meetings on serial communications, right? So don't be careful about, even through an intermediary, having sort of conversations between multiple board members outside of a public meeting.
Thank you. Okay, so with that reminder, again, if you have other ideas for the agenda for future meetings, please reach out to the co-chairs and let them know so that they can bring it up in our monthly agenda planning meetings. But in the meantime, OHA and PR will be focused on organizing these work group meetings and preparing for that August meeting. Thank you, everybody.
Thanks, Jenny. Thanks, everybody.
Thank you.